Hi, I'm Dr. Guantor. As girls grow up to become women, their bodies go through many changes. This process is called puberty, and it prepares their bodies for adulthood and the possibility of becoming pregnant. Puberty usually starts somewhere between the age of 9 and 15, although the average age is 12 years old. Girls going through puberty will notice changes in their emotions, such as more intense emotions or feeling their emotions are quickly going up and down. They will also have many changes in their bodies. During this time, they develop breasts, grow armpit and pubic hair, and eventually start having menstrual cycles, something we also call menstrual periods or just periods for short. Girls all have questions and concerns about menstrual periods and want to know what to expect. Providing them with factual, straightforward answers helps relieve their anxiety, dispel myths, and better prepare them for the changes in their bodies and lives. Part of becoming an adult is to develop a sense of respect for other people and sympathy for the challenges other people face. Knowledge about the menstrual cycle by young people can help promote awareness and respect among both girls and boys. Let's hear some of their questions and give some answers that will help girls understand what happens during menstrual periods.
What is a period?
A period, or menstrual period, is what we call the discharge of blood from the vagina that occurs for several days each month. Periods can sometimes be scary for girls when they start, but there's nothing to fear. Periods are completely normal and a sign of a healthy body.
Why will I have periods?
To better understand your period, you should know what is happening in your body. Let's start with an explanation of what is happening and why it is happening. Every girl has 3 openings on the lower part of her body. In the front is the urethra, which is the tube through which urine or pee comes out of the body. In the back is the anus, which passes feces or poop. The vagina is located between the urethra and the anus. The vagina is the opening to the uterus or womb where babies grow. It may seem like the urine comes from the vagina, but the opening of the urethra for urine is actually in front of the vagina. The labia are the folds of skin outside the body that form the opening to the vagina. The labia are also called genitalia. Several important organs for reproduction are located inside the lower abdomen of women. The vagina is the opening to the uterus or womb. The uterus is attached to the upper part of the vagina. The uterus is where a baby grows. Also in the lower abdomen on either side of the uterus are the 2 ovaries. A woman's eggs are located in the ovaries. The ovaries are connected to the uterus by 2 tubes called the fallopian tubes. Ovaries have thousands of eggs in them. Each egg is very small and can only be seen with the microscope. Every month, 1 egg passes from one of the ovaries. The egg goes through the fallopian tube and into the uterus. At the same time that egg is released, the ovary also produces hormones, which are chemical messengers in our bodies. These hormones cause the uterus to grow a thick lining of extra tissue and blood inside the uterus. This thickened lining in the uterus creates a bed where the egg can attach if it has been fertilized during its passage. If the egg is not fertilized, it passes through the uterus and out of the body through the vagina.
What does fertilize mean?
The word fertilized means that a man's sperm has joined with the woman's egg and the genetic information in each has been combined to start a new life. Fertilization can occur in the fallopian tubes or inside the uterus. The man's sperm get into the uterus when a man and woman have sexual intercourse, also called sex for short.
What is sex? I've heard about it, but I don't really know.
Sexual intercourse is when the man's penis is inserted into the woman's vagina. During sex, the man's sperm are released from the penis into the woman's vagina. This occurs during ejaculation, but sperm can also be released at any time while the penis is in the vagina, not just during ejaculation. Ejaculation is a spurting of liquid called semen that contains many sperm that are made in the man's testicles. Sperm are so small we cannot see them without a microscope. Each sperm contains half of the genetic information needed to make a new life. The other half of the genetic information is in the woman's egg. Some of the sperm swim their way into the uterus and fallopian tubes, where one of them may join with the woman's egg to fertilize it. If the egg has been fertilized, it can then attach to the rich nutrient bed of the uterus. When this happens, a sac filled with fluid forms around the new life, which is called a fetus. The sac protects the fetus during the 9 months it takes for the fetus to develop. When it is time for the fetus to be born, the fluid-filled sac surrounding the baby breaks, releasing fluid out of the vagina, and if all goes well, the baby is born by passing out of the uterus and out of the woman's body through the vagina. If the egg is not fertilized, it leaves the body through the vagina. This is also the time that the extra tissue and blood that lines the uterus passes out of the body, since it is not needed to help a fertilized egg grow. The passage of the blood and tissue from the vagina is called the menstrual flow or menses.
How long will the blood flow last?
The amount of time that the blood and tissue passes out of the vagina is usually 3 to 7 days, but it varies for each woman. We call this period of time of menstrual flow the menstrual period. Many people just call it a period. The 3 to 7 days period of menstrual flow occurs roughly every month, about every 28 days. During the first 1 to 3 years after a girl's period begins, the bleeding can be as short as 1 day or as long as 14 days. Also, the timing of the cycle in girls can be very irregular, from 2 weeks to 2 months. However, if a girl has had sexual intercourse and the period has not arrived at the expected time, it is possible she may be pregnant and she should visit a healthcare provider to check.
How much blood is there during my period?
The total amount of drainage from the vagina during a girl's menstrual period varies and can seem like a lot, but it usually is about 2 tablespoons. There is more flow during the first day or 2 of the period and less later. Some girls have more menstrual flow, and it can sometimes be up to several cups of blood and tissue fluid during the menstrual period. There is nothing bad or dirty about the menstrual flow. It consists of just blood with a little tissue in it. Menstrual flow can stain clothing and it can be messy, but it is actually clean and normal. Do not believe myths that try to say otherwise. Blood contains iron to help it carry oxygen throughout our body, so iron is an important nutrient for our bodies. When girls lose blood each month, they also lose the iron in the blood. You can see why girls and women need to eat foods rich in iron such as red meats, fish, insects, and green leafy vegetables to replace this iron they lose in the menstrual blood each month. Sometimes they even need extra iron in the form of pills, powder, or other supplements, especially when they are pregnant or breastfeeding. Women have menstrual cycles during the part of their life when they can become pregnant. The time of life when menstrual cycles stop is called menopause. Menopause happens for most women when they are between 40 and 55 years old. At this time, the hormones change again and the woman cannot become pregnant anymore.
Having a period sounds a little scary.
The first period can be a scary time, but if a girl knows what is happening and can prepare for it, it may be a little easier. A little preparation may also help girls avoid the embarrassment of discovering blood on their clothing when their menstrual period starts. One thing they could do is carry a menstrual pad in a bag or have one nearby. They could then use the menstrual pad to catch the flow when it occurs. They could also carry an extra pair of underwear in case their underwear gets drainage of it. Up to a year before a girl starts to have her period, she may occasionally have some clear or cloudy liquid that comes from the vagina. This is normal and indicates she will be starting her periods soon.
What is a menstrual pad?
A menstrual pad can be placed inside the underwear to catch the vaginal drainage during the menstrual period so others don't know a girl is having her period. A menstrual pad is also called a sanitary napkin. The menstrual pad can be attached to the underwear to keep it in position. It has an absorbent layer and a waterproof lining to reduce the chance of leakage. The menstrual pad is changed to a fresh pad when it seems full. It will need to be changed more frequently during the first days of the period, perhaps every 4 to 6 hours, then less often as menstrual flow lessens. Some menstrual pads are disposable, so they can be thrown away when they are soiled. Others are called reusable menstrual pads because they can be washed and dried, then reused over and over. Certain reusable menstrual pads last as long as 3 years, so they save a lot of money compared with the cost of disposable menstrual pads. Let's talk a little bit more about the reusable menstrual pad. When it's all assembled, it will look like this, and I will walk you through so you learn how exactly to do this. So in the reusable menstrual pad kit, which will be in this little bag here, you will find the reusable fabric, which is this one here, and the pad holder. So what you do is you take your fabric, and this will depend on how heavy your menstruation is. You can use 1 fabric, 2 fabric, or even 3 fabric if you need to. If you look at this fabric, you will notice there is a heavy middle section, and then the side section a little bit thinner than the mid section. So you fold your cloth in thirds, so like this, and then you bring this side in. You make sure you have your thin side on the outer part so that you can tuck them in the pad holder. So you carefully tuck them in, put them straight so it doesn't feel bulky and bother you. So if, say, it's a day where your menstruation is a little bit light, you can use 1 pad. But say it's a little bit heavy and you're not sure if 1 pad is enough, you can take another cloth, again, fold it in thirds. The thinner side gets tucked in on top of the other one. Straighten it out, good. And here you are. You have your reusable menstrual pad. And you will then put it on your underwear and snap it so it stays put. I will show you in a model how to use this, but just before I do that, I just want to show you again how this pad has pouches up here and another pouch down here for tucking in the fabric. And this fabric is very, very absorbent. And the pad holder has a waterproof barrier that will prevent it from leaking. So once you take down your underwear, you'll put the reusable menstrual pad on your underwear and then use the snap to anchor it. Once you have it all nicely set up, you can pull up your underwear, and here you go. And you can see there's a little wings on the side to prevent the side leaking. So once you have used the pad, you can take out the fabric And if you're at home, you can soak both the fabric and the pad holder in water for a little while until you're ready to come back and wash it with soap and water. If you are away from home, you can use this plastic bag that's enclosed in the kit. Put your usable fabric pads in there and carry them home with you. Then once you get home, soak it in water for a little while and then wash it with soap and water. This kit will contain 2 of the pad holders. So in case one of the pad holder is wet, you can also keep it, put it away, and then use the other one until you're ready to wash both of them, and then wash with soap and water and hang them to dry outside in the sun.
What is a tampon?
Another product is called a tampon. It works like the menstrual pad to control the menstrual flow. A tampon is made of a disposable absorbent material about the size of a thumb with an attached string. The tampon is put inside the vagina and the string allows it to be removed when needed. A tampon should not be left in the vagina longer than 8 hours because of the risk of infection. Tampon can be used by girls and women, even girls who have not yet had sex. Rags can be used as another alternative to control menstrual flow, but they are more likely to leak and they don't stay in place as well as a menstrual pad or tampon. If you use rags or reusable menstrual pads, be sure to wash them thoroughly with soap and water and dry them in the sun because sunlight kills microbes that may cause infection. With the use of menstrual pad or tampons, no one needs to know that a girl is having her period. She can continue with all her activities and interact with anyone she wishes, including men.
Do I need to clean my vagina?
Vaginas do not need cleaning. They are naturally clean, even during the menstrual period. It is normal for vagina to have a small amount of drainage, and the drainage may have a slight smell, even though it is clean. You don't need to rinse out or wash inside the vagina. You should wash the labia or genitals with soap and water, but never put soap or other cleaners inside your vagina. Aside from the menstrual flow during her period, a girl or woman will likely also notice some other symptoms, particularly during the week before her period starts. She may have headaches, breast tenderness, weight gain due to fluid collecting in her body, and joint or muscle pain. She may also have irritability, anxiety, poor concentration, sleep problems, or changes in her mood and appetite around the time of her period. Although these symptoms are often not pleasant, they are all normal and common parts of life for every menstruating woman. If cramping in the lower abdomen during menstrual flow is bothersome, exercise and warm compress has been shown to help. Pain medications such as paracetamol can also help with the discomfort. If pain becomes too severe or unbearable, see a healthcare provider for further evaluation. Periods are a normal part of a healthy woman's life, and they are not something to be ashamed of. The menstrual flow is clean. After all, it's just blood and a little tissue. Women who are having their periods are not dirty or sick. They cannot contaminate anything, including food or crops, by touching or being around them. Remember that the menstrual flow can be messy, but it is clean.
Can I play and do other things when I have my period?
With an effective menstrual pad or tampon, a woman can do any kind of activity she would normally do when she's not having her period. Girls can continue to go to school, do their normal work, and join in with activities. They can exercise without any concern for their health. They can wash their hair and even take a bath during their period. It is also safe for women to have sex during their menstrual flow, but they certainly can get pregnant. So they should always use contraception such as condom, birth control pill, implant, Depo-Provera, or other forms of birth control. Sexually transmitted disease can spread with sex at any time, including during the period, so condoms should be used to reduce the risk. Unfortunately, people don't talk very openly about periods. This secrecy leads to myths and other stories about menstrual period and reproduction that are not true. We hope this video provided factual and helpful information to understand the menstrual cycle and address the concerns of girls and women. Starting periods is a sign of a girl growing up. It is completely normal and nothing to be afraid of. Girls with questions should ask women in their family or speak with a healthcare provider to get more information.